Okay, go.
Okay. Hi, you guys. We have a special guest tonight, and I'm so excited. Her name is Dr. Christine Page, and she is honoring us with her time this evening. And I have some questions I'd like to ask Christine, and I'm going to call you Christine. Is that okay, or would you prefer?
Absolutely. Fine.
Okay.
Perfect.
Okay, I want to make sure that's okay. And then I want to also, as we're going through some question and answers, I'm going to show you guys some different places you can find more information about Christine, which you'll see on the background of this recording. This is going to be audio with Christine instead of video. And so I'm just going to get right into it. Christine is a medical doctor, a medical intuitive. I mean, I think super gifted in every way, but I think it's the intuition with her medical knowledge that makes her quite unique. And we're going to go into some specific questions about that and how she got to where she is today. She's an international author, speaker. She does workshops, lectures. She has lots of great YouTube stuff that's for free that you guys can check out. And she's going to be my special guest in Houston in April, the third weekend of April. We'll get to more of that later, but it's going to be workshops and private appointments. So I'm super excited to have her in Houston because there's so many people. I mean, Houston's a huge city. So many people need to hear what she's saying. But I'm going to get right into the questions if that's okay with you, Christine.
Perfect. Wonderful. Thanks, Gwen.
Okay, for those people that don't know you, tell us a few things about yourself, including how you originally became interested in complementary medicine and ended up becoming a doctor.
Oh, wonderful. Well, you can hear I come from England, and always people ask me. I was born just east of London, but I consider myself a Londoner. I've always been around London, and in Britain we have a much more substantial, looser freedom to practice alternative complementary medicine. So we still have 5 homeopathic hospitals within our National Health Service. We've always been able to see acupuncturists and healers within the National Health Service. And therefore, the ability for me to be bathed in this as a kid was wonderful. My mother was very interested in all things esoteric. She was very down to earth. She was a Scot. But my grandmother and my great-grandmother and my mother were all known to be what they call fae. And to be fae is to have the gift of being able to see. So my great-grandmother was a woman who we would call a social worker now, but she was called out to every birth and death. And it was really the tradition of women to be at those particular places, and that it was the role of women to be around birth and death, hence my now interest in women's care. But my grandmother would be the one that everybody would come to around the kitchen table and ask her advice. And then my mother carried on that tradition. So the ability to have strong matriarchal energy, but also strong healing, loving, wise energy was mine from the moment I was born. And my mother was surrounded by friends who practiced healing, homeopathy, energy medicine, sound medicine, sound therapy, color. So I was immersed in this as a child, and I thought everybody did this. I thought everybody had people who would come in and tell you the latest form of therapy they were doing. And one of her closest friends was a wonderful homeopath and healer who developed breast cancer. But in the years that Auntie Joan had that cancer, she tried all sorts of different ways of helping herself, which were very successful in terms of the grape diet, the urine diet. So there's very little I wasn't immersed in from a very early age. And at the same time, I always had that desire to help people. I suppose we all wonder what we're going to do. I would always love carrying my little doctor's bag around with me and looking after all my dolls and healing everybody. So it was inevitable that I was going to go into some sort of practice. And by the age of 11, I was in a first aid organization called St. John's Ambulance in Britain. And so I was already gearing myself up for that. But perhaps I just want to say before I go any further is that I also haven't always been intuitive. I didn't suddenly develop it. So I've always been able to see people's energy. And as a child, I didn't know what I was seeing, but it was somewhat confusing because I was seeing many different, what I call many different layers of an individual. And when my mother would say to me, well, you know, say hello to this person, I would almost be saying, which one am I saying hello to? Because there's so many of them here. And I would find that very challenging. So I was initially a very shy child and would be told off for being, you know, be nicer to people or don't hide. But I think I was just terrified, and maybe some of the listeners will be able to relate to that sensitivity that wasn't just, oh, I'm shy. It was confusion. I didn't know who I was talking to. And my second level was that I could pick up, or I could see these layers, but the ones that really bothered me were the ones who were suffering. So that when I saw somebody who was smiling, but I could feel and see the suffering part of them or the despaired part of them who was crying out for help, again, as a child, I didn't know what to do. So I went beyond the just being shy to fainting. I decided fainting was a way of getting out of the situation. And
wow.
I learned to faint at an early age. And so I just want to finish this piece by saying the irony was that at 11, I became a St. John's ambulance person, which meant I would have to go to places that people were suffering. And I would pray that nobody would ever get sick, because if they did, I would faint. And so ironically, I did this for 7 years until I was 18. And in Britain, we choose what career we're going to go in by the age of 15 or 16. So I entered medical school when I was 18. And people would say to me, oh, what made you become a doctor? I have to say, it wasn't because I could do the academic work, or it was really an urging from my soul that I needed to do this, because truly I would have done anything else to stay away from suffering people. And I was fine while they were having surgery because they were unconscious, or when they were dead, I have to say. I didn't mind doing anatomy. It was when they were hurting that I really found it difficult. But from a soul's point of view, I realized that I had to learn to put up good emotional boundaries, because I couldn't just keep on fainting. And as a doctor, I learned how to do that. Otherwise, I would not have survived. So I still have the intuitiveness, I still have the empathy and the feeling, but I had to learn not to take it all on myself, which I can assume many of you listening may have also had those same issues.
Wow, I could go another. I could go on that tangent for about an hour. How you got out of your body by fainting, you know. Anyway, I won't go there because we'll save that for when you're in Houston. I want to ask you, what kind of medicine were you originally focusing on when you went to medical school?
Well, again, we do everything in Britain. So I would consider myself a fairly good surgeon. I can do simple surgery. I did a lot of obstetrics and gynecology. I enjoyed pediatrics. I did a lot. And so we do that. And then if you chose, you could specialize. And I chose to actually become a family practitioner, or a general practitioner, as we call them, because I actually care more about the person in their environment than within a hospital setting. So I was very fortunate to find a practice where three of us looked after 9,000 patients. That sounds a lot, but we had 9,000 patients between us. And we got to know those 9,000 patients extraordinarily well. So what happens is that we did house calls, we did night calls, we looked after the families. And of course, that's not practiced here so much in the US, and it's not practiced in Britain as much. But I will say is that I found the value of knowing the patient in their setting so much more important than just seeing Mrs. So-and-so who's got a gallbladder problem. And I did a lot. I loved networking people, so that it was really a community. I think this is the future of healing. It should be community-based, where if I knew someone was having a problem, I could connect them to someone else who had had the problem and got through it. And I set up I loved my practice I was in, because we set up a lot of teaching. I teach them all sorts of complementary medicines, crystals and ETs and anything. And my clients loved it. You know, there's like, what are we going to learn now? And I teach them homeopathy, aromatherapy. This was all in the mid-'80s. And then we would set up a lot of groups so that people would support each other, obviously cancer support groups, but MS support groups. And we did a lot of dialoguing between the hospitals and the general practitioners. So you can hear, I really feel that I love working with people, but I love communication, I love sharing, I love helping people to have the information that's important to them to be able to make decisions. And that's what I see I am. I'm a bridge builder, a messenger, a translator of information, and can help wherever I can.
Wow, that's incredible. I mean, and time consuming, right? That level of care is time consuming.
Yes.
So I want to ask you the next question. When did you start to realize that illness was the messenger of the soul? And was this why you wrote your bestseller book, Frontiers of Health?
It was. I mean, so here I am. I did my several years of working in the hospital setting and then went into general practice. I will say that I was in New Zealand for a year as a doctor, and there we had probably 4 or 5 doctors for 10,000, well, actually 10,000 patient hospital. So we really, we were kind of looking after a lot of people in a small, the hospital was only 110 bedded, but we had an area that we were looking after. And there I really learned how to do good medicine and use my intuition, because you can't work in a busy ER and not use your intuition. And there I was able to really listen in. And I know that this might be something you were going to ask me afterwards, but I really want to say is when you're in an ER, you have to be able to listen to your intuition, because I would have several times where the patient's tests may come back normal, but I knew there was something wrong with this person. And maybe everybody was saying, well, just send the patient home. They're ready to go home. And I said, no, we're going to hang on to them. And of course, they would then have the heart attack that I knew something was wrong, but I wasn't able to put a finger on it. Or I was very good at listening to, a child, being able to intuit what the child was trying to put across, because children can't always tell you anything. So there's a lot of different things that I worked with. And one of the things that happened when I was in general practice was that I kept seeing clients with the same issues and would almost be giving them the same advice, because I could see a personality type. And so here it was, the person who has lower back pain. And they would then sit and talk to me and tell me, oh, I don't feel supported. Nobody's there for me. I've always supported everybody else, but nobody cares about me. And I went, okay, this seems to be a personality issue. I don't want to say personality issue, more of a trait. So that this was back in the 80s, and I know that Caroline Myss wrote wrote a book almost the same time as I wrote Frontiers of Health. And we both realized that there are situations that come up. The person who's got the sore throat, what are you not saying? The person who's got shoulder pain, what are they, where are they carrying everybody? The person who, I would sit with people who had their first heart attack, and they would tell me, oh, I'd love to, I'd say, well, what are you going to do? And they'd say, oh, I can't do anything differently. This is the way it's got to be. I've got a mortgage. I've got children to put through college. I've got to keep my pension plan. And I could feel the way that the heart had lost all the joy in life. There was nothing left. It was all must, should, can't, ought to. And you could see the blood vessels getting narrower and narrower as the joy went out of their life. Wow. And we worked very near a Ford's factory in Britain. And, honestly, these poor, most of them were men in that time, were telling me, I've got to get back to work. They won't give me my pension if I take any more time off. They won't do this. And it was like, oh my goodness, back in the 80s, there was no caring for the individual in a factory. It was, you have to get back there. And I used to say to them, well, look, when you're 6 foot under, I can be very blunt, but when you've been buried, nobody will care what you did. And you look at the newspapers, you look at the obituaries, and they're like, oh, he died at work with his boots on, as we call it in Britain, what a great man. He never had a day off work. And, he worked as hard as he, and You know, and then I said, they never write, yes, but he left a wife who is desperate. He never saw his children graduate. He never saw his children, you know, get married. There was too much of that stiff upper lip, but it's in America as well. That sense of, isn't it wonderful to work hard until you die? You know? It's like, no, that isn't as good. So
right.
you can hear that this is why I wrote Frontiers of Health, because in Frontiers of Health I've written about the chakras, which I'm fascinated in, the energy chakras, and I saw that each chakra is linked to a specific area of the body, specific endocrine system, specific illnesses, and then some specific issues that each of the chakras carry, like what are you not saying through your throat chakra, and where are you taking too much energy in through your solar plexus. And hence that's Frontiers of Health, and it's why it's become such a popular book around the world, because I put in as many illnesses as I could and the message of disease. And why, and I can talk about this later, but why I feel illness is not a problem. It's not something to be fixed. It's a message from the soul asking you to change direction, giving you an opportunity to change direction. So I like to call illness a solution rather than a problem. And yet, even within all the people I work with in the complementary alternative field, there's still this need to, okay, you've got this problem, here's the thing you're going to be fixed by. And it irritates me because we're considering that illness is a problem and therefore not connected to the soul. What if we said, wow, the soul is giving me this problem in order for me to take time to expand, to change direction, etc. And for my own part, I developed breast cancer 6 years ago. And when I did, I said, wow, my soul must love me really so much that it gives me breast cancer. I will not waste this opportunity. Wow. So there you go.
Well, and I think, you know, sometimes it's easier, or people at least think it's easier to take a pill than to change something in their life. And so I think that that's a strong message.
Oh, it's always easier. It's always easier. And as I say, we have to be very careful as therapists that we don't encourage that. You know, it doesn't matter what type of therapy we're doing. If we're doctors, if we're complementary, if we're whatever practitioner, we need to stop and say, if this being that's sitting before us is actually not an idiot and not just made a mistake, what could their inner being, their soul, be trying to tell this person? And I've got many examples where the person thinks they're fixed or cured, but nobody's actually addressed the issue that's underneath that. Shall I give you an example?
I would love an example, because I think that it's really relevant to what you're talking about.
Okay, so I'm remembering a young woman, 33, and 33 is an age when we start doing the work we came here to do. So often it's a crisis point as well. But she was a young woman who was the eldest of 10 children. She had 4 children of her own, and she was a teacher. So she had a lot of people who were dependent on her. This wasn't something she wanted to have, but it happened. And every time there was a problem in the family, it would be she that they called. So she developed a rare type of lung cancer. And when I spoke to her, she said, you know, I feel as if I'm drowning. And that's what her lungs were feeling. Her lungs were feeling is, I can't breathe. Everybody is on top of me. And a lot of the work we do, and we do it in the workshop that I'm going to do in Houston, is listening to the wisdom of the body. Listen to the language of the individual. And so often we're so caught up in a diagnosis, we forget to say, wow, this person's telling me why she can't breathe, why she has lung cancer. So she got all the treatments, she had treatment, and I didn't see her at that time. I saw her after. What happened next was that she was cured in terms of there was nothing on the scans. And she went on a summer holiday. It was the vacation from the school holidays. And she was coming back to start the next school semester. And all of a sudden, she developed this severe pain in her body. And it was so severe that she was on a ferry at the time, or a cruise. She actually had to be winched off by a helicopter. It was so bad. She couldn't wait to get to the next port. And when she got into the hospital, they found that the cancer was everywhere. And this was within 4 weeks of being given a clean bill of health. And what she told me when I met her, I met her for the first time in the fall of that year. She said, nobody ever asked me what was happening in my life. Everybody was just fixated on getting me back to school, getting me back to the same situation, including my family. Everybody just said, well, when are you going to be back? When are you going to be well again so we can come and talk to you about our problems? And she said, I couldn't do it anymore. I could not breathe. So she actually, by the time I saw her, she had given up her job, even though she was young, but she had retired with ill health. And she had told the family, I cannot be the source of your, I can't take on all your responsibility for all your problems. Please stay away from me. But that took a lot for her to have the voice to say that. And I know, having developed cancer myself, 85% of people with cancer are nice people. I consider myself a nice person. We're pleasers. We want to please everybody. So actually saying no to people is tough when you have cancer or as a cancer personality. But it is the first step to taking care of yourself and looking after your own health.
Right, the ability to say no.
Yeah.
Well, let me ask you the next question.
It's different for everybody, Gwen, because I find that, people who have no difficulty saying no think, well, why would that be such an issue? But people who do have a difficulty saying no, I can tell you, I remember a woman who had breast cancer, and she could tell no to everybody except for her mother. And I said, just go and tell your mother you're not going to, I think it was, come to dinner. She said, oh, I couldn't do that. She said, I'd rather die than do that.
Oh.
And I've got to tell you, I meet many people who tell me this, that to do something different, to give up work, to stop working, to not do something, is they would rather die. That's why people also get sick. It's because nothing else will prove it. I've done a lot of work about what was the messages you received as a child about getting sick. And many people tell me it was the only time anybody took notice of me, when I was sick. And so I've realized for some people, they have to break a leg to get everybody to, oh, you've broken your leg. Sometimes people won't hear you when you just say, I'm ill, or I'm not feeling up to it. You have to do something very outwardly extreme in order to get other people's opinion, get their attention. But then often they'll just say to you, oh, well, are you better now so we can carry on doing what we were doing? So it's amazing. Each of us has our own issue. I remember there was a time I was having some bad headaches, and I was actually continuing, because a lot of my work is on the phone. As an intuitive, I can do it over the phone. And I would have such a bad headache, but I would say, oh, well, I can keep going. I can keep going. Nobody notices I've got a headache. And then I started vomiting. And I remember this one time I said to this woman who I was giving a session to, I'm really sorry, I'm going to have to go and vomit. And she said, don't worry, I'll be here when you come back.
No way.
And I thought that really taught me is that actually I need to take care of myself because other people are not going to.
Exactly.
So that's, and that's not uncommon. I find that people actually allowing others in to help them around the world, that's really an issue. That's the sacral chakra. 75% of people I meet have difficulty letting people help them. And that's particularly within the healing professions because, when you're a healthcare helper, nobody's going to say to you, hey, can I take care of you? They come to see you because they want help from you. So a lot of people who are in the healing professions actually hide there because they don't want to feel vulnerable or lose control of their situation.
Well, you're speaking to the right group here with healers and also people that, I know a lot of people that are healers and practitioners, but also sometimes they have a dual career. But right. I think it applies, either way. Well, let me ask you this having to do with your intuition. You already said you had it basically from birth. how do you get information? Do you hear it, see it, feel it? How do you tune into the body, and what kind of messages do you get?
Okay, I first of all, I probably do it all. I can read anybody's energy as soon as just listening to them all. And that, as I said, was a problem when I was a kid. I would say I have clear gnosis because I actually just know something. And when I know it, I can feel it really strongly in my own body. However, then when I know something, I then get images for it, because the images help me to almost get a bigger picture of what's happening. So I often feel I'm like looking through a keyhole. I get the initial knowing, and then I'll start to see through the keyhole, oh, there's that. And it might take me to a past life. It might take me to a specific memory, or it might take me to something that says, oh, I understand what's going on here, like the woman who was feeling that she was drowning. Occasionally I will get symbolism as well, but again, when I'm teaching this, and I love teaching this, I've run many courses on intuition. I had a 3-level training for 4 years of teaching complementary and doctors and other health practitioners about listening to the intuition. And I think that this was a really important part that I found was everybody can listen to their intuition. The listening is not the issue. It's following through on what you hear. And that's the bigger problem.
I think that's true. Well, that leads me to, when did your love of teaching, go ahead.
So I feel that what I love sharing with people is to have the courage to follow on, to follow through, and to be able to speak it. So having a workshop where you're not just listening, I can't teach intuition by me talking. Whenever I do workshops, you come to have an experience, because especially with intuition and by listening to the wisdom of your body, it's no good just listening to me. It's listening to yourself, listening to your body, and then working in small groups. And there are several exercises I do, especially in the intuitive workshop, where people go, oh my God, I'm so good at this. Look at me. I can do this. And a lot of times we don't have that much, that ability to not only practice, but get feedback from people. And so for me, when I'm doing a workshop, I really want people to feel confident to say what they're saying. But I also have to remind people that if, for instance, I get colors or images or words, they're coming through my mind, not the mind of the client. So, I don't encourage people to say, oh, I see that you're red. What does that mean to you? It's not about the other person. It's about what it means to you. So each of us have, through our own guidance, maybe through our spirit guides, through our own intuitive inner knowing, we will have a particular technique that helps us to know that when we hear something or when we see something, we should follow it, and it's really good. And so I like to give tips as well, that it's 2 different things really. Or let me say it's 3 different things. Let me say this. The ability to pick up information is called your being psychic. And somebody who might consider them an empath or sympathetic, they are often very psychic because their solar plexus is like a sponge, and they're literally absorbing the energy of other people. Now, that's okay, as long as you know what is your energy and what is someone else's. And the problem of being an empath is that you don't always have good boundaries. In fact, more often than not, you're walking around and picking up the worries of the world, and that doesn't help anybody. So one of the things I teach when I'm teaching intuition is to develop good emotional boundaries, which also means you need to be able to do your own work. So in many years, I've really been saying it's not enough for you just to say, oh, I'm reading you, without knowing what's inside you. I've had people say, oh, I don't need to do my own work. I'm just a natural healer or a natural clairvoyant. There isn't such a thing. Because I like to say that if you take water and put it through a rusty pipe, it's going to come out rusty. So however clear the energy is that's coming through you, you have to clear up your own energy in order to be able to see clearly. And my awareness is that sometimes there are mediums or psychics who have a scratch on their lens, we could say, on a lens of a pair of glasses. But if you don't know the scratch is there, you're going to see everybody with the same scratch, and you'll think that that's them, but it's actually your scratch. So being psychic is one thing, and you can pick up that information up, as you said, clairvoyant, clairaudient, clairsentient, different ways that we would go through in the workshop to do that. But once you've picked up information, being intuitive is different. Intuition is, what do I do with the information once I've received it? And that then says, okay, I've received this information, and you take the information to your heart and you say, what is the most compassionate thing I can do in this moment? Secondly, you take it to your third eye and you say, what's the wisest thing I can do in this moment? So being intuitive is the ability to pick up information, but also use wisdom and compassion to know what to do with it. And then my final thing I'm just going to say here is, that's when we're working with other people. The more difficult is listening to ourselves. And we can get so caught up in watching all the signs out there that we miss the signs for ourselves. And so I would consider myself someone who is always been listening to what the message was that have come to me. And of course I've missed some, but that was really been my journey, is that I've never really known what the next step is. When someone said to me, what are you doing in 5 years' time? I thought, I have no clue what I'm doing in 5 minutes' time. That I've always just stayed in the present to be able to hear the signs. And what I always say to people is, it's good, the spirit world wants to help us, our guidance, whatever you, angels, whatever you want to call, but they often say to me that we don't ask the right questions. So we might say, well, why is this happening to me? And they can't answer that. But if we say to them, if I'm not meant to do this, make it really clear now, they can help us directly on that. But once we get those messages, just to finish on this, once we get those messages, we have to follow through. And over again, I hear people say, I remember a lady coming to me and saying, in my meditation, Jesus came to me 5 years ago and gave me a pen and told me to write. And then she said, so what do you think I should do? Should I write? And I hear this one so many times. Oh, lots of people have told me I should do something, but I'm wondering if I should. It's like, how many people do you need to tell you something? And that's the saddest part, that intuition is following our heart. Intuition is listening to our heart, becoming whole in ourselves, the true meaning of healing. But so many times I see people who are going to come in on the same level of consciousness and almost go out on the same level, because it's just been too risky for them to do something that's unknown. And that would be the saddest thing for your soul. There you go.
I really, really, truly hope thousands of people listen to this after it's uploaded to Vimeo and YouTube, because I think that what you just said is worth this whole time. And, I have a lot of practitioners as clients that are so, also, we talked about this earlier today, but being out of your body, right, that they dowse or they muscle test or whatever, but they totally will ignore their own bodies and say, no, this is fine, this is fine. And they're debilitated, they're insulin dependent, they won't change their foods, they are not really in tune with themselves at all.
Right.
And they keep seeking help, and sometimes they'll say, please don't fire me as a client, I get that I don't need that. And I'm like, but you're not listening. You're not listening to me, but you're not listening to yourself, which is most important. So I'm so happy that you just went through the time to say that, because I think it's so important.
Oh, thank you, Gwen. It is. It's, especially now we have Google, we have internet, we have so many ways in which, what shall let me Google what I need to do. And it's become so head-based. And really, the body is such a great friend. I say the body loves you so much, it will even die for you.
And
so when we get sick, the body is saying, I will not let you go along this destructive path that you're on anymore. I will stop you. Yes.
I mean, I think that's very to the point. That's the message I think people need to hear.
It is. I remember just a story about a woman who was an actress, and she was on quite strong opioid-like drugs for backache and period pains and things. And she was seeing me as a homeopath, and I said, why don't you take some time out from acting and get well, get off these drugs and everything. And she said, oh, I can't. I have to either act or I've got to be going to auditions. I can't take time out. And she came to see me about 6 weeks after that, and she was covered in the spots of chickenpox. And I laughed because all these spots were on her face, and nobody wanted her in the theatre. So she could not work. And I went, thank you. And every time she thought that very last spot had gone, another one would appear on her face. And so, it's like when someone says, I need a break, and they fall down some silly little step and break their leg. The body always listens to us. And it says, I will do this, and you will stop in your tracks. And therefore, it makes me so sad when people say, oh, don't worry, I've got crutches, I'm going to keep going. And you think, why? Because the body is actually giving you such a gift. And nothing can be more important than actually listening to that gift and actually taking notice of your body.
Well, it's obvious that you love teaching. How did you start teaching, or when did you, it's obvious you love teaching. So how did you get into teaching versus the medical side and the intuitive side?
Yes, I would say I hope my intuition always works through me. When I'm teaching, I'll often go off at not a tangent, but I'll often talk about something, because you can hear I have a wide range of memories. And I think, why am I talking about that? And I will be guided that someone needs to hear that in the audience. So that I'm always listening in to what is it the audience are wanting to hear or needing to hear as I'm speaking. I hope I never just tell the same thing all the time. I'm always just moving things accordingly. And I feel that, I felt I enjoyed my teaching when I was even a teenager. I used to teach then. But I was in New Zealand, as I shared with you. And I think before I went to New Zealand, and I was probably 25, 26, we qualify very early. So I was a doctor by the age I was 22. And I always thought, oh, my God, I look at 22-year-olds now. I was I was in charge of 3 or 4 wards of sick people at 22. And I just felt, wow, there's a lot of responsibility there. But when I was about 25, 26, I was running what we call a family planning clinic, really just giving advice of all the different methods that are out there. And I ran that for a couple of years before I went to New Zealand. And so when I went to New Zealand, I had to give a talk on something, and I said, oh, well, I'll talk on family planning, since it was to my doctors. And they said, wow, that was so good. Could you talk to the rest of the hospital? So there was one day I had everybody, from the cooks to the cleaners to the doctors, everybody came in and talked. Liz wanted to hear about family planning. And that was my kind of remembering of actually the ability, I hope, to make information simple and easy and accessible to everybody, because I think doctors can get caught up in the big language that really makes people feel very helpless. And I've spent so many nights sitting on people's beds in the middle of the night, going through what we're doing, why we're going to do this, what are your worries, how can I help you? So I hope, as much as that I'm a doctor or a teacher, I hope I'm also a good listener, because those two go together.
I think so. Well, I have one of your books up on the screen, and I know you have multiple books. So if someone's not read your books, should they try to read your books in order, or can you tell us a little bit about your books and maybe which one to go to or what order, and also tell us about your latest book?
Perfect. Well, this one, Frontiers of Health, is the one that is probably my Bible, or people call it their Bible. It's got all the illnesses in, as you can see, and thank you for putting that up. I go through the chakras, the meaning of disease, the chakras. And when especially when I'm in Tokyo and when in Japan, people have these little tabs in different pages, because it's meant something. But I will still hear people years on saying, I still use this when someone comes to see me. I'll look up, what did Christine say about this book, excuse me, about this illness. And they find it very valuable, not only for them, for their patients, but also for themselves. So Frontiers of Health is that book. Then I wrote another book, a small book, Mirror of Existence, which was very much about the stepping into wholeness, which was the tough thing that none of us really want to hear, is that when we don't like somebody else, we're meeting a part of ourselves. So it was very much about looking at the mirror and who are we, and can we recognize that the best way in which we know ourselves is through other people, and that if you get irritated by someone else, they really are in your life in order for you to know a part of yourself. And of course, if you admire someone, the same thing. If you say, oh, that person's wonderful, well, there you're meeting yourself as well. So that was the Mirror of Existence. And I think you had Beyond the Obvious there, or Spiritual Alchemy was my more esoteric book, or Beyond the Obvious. This was my intuition. I'm sorry, we're jumping now. Let me stay with Spiritual Alchemy. Spiritual Alchemy has a lot about sacred geometry, the grid, anything around that. I mean, my world has not just been about healing. I love looking at different levels of consciousness, multidimensionality, spiritual, sacred geometry. It's the reason why I take people around the world. We're going off to Ireland in September, just really to allow ourselves to go into these sacred sites, which I believe have multiple levels of consciousness there for us to tap into. So this is another part of my life, is really loving Mother Earth and being able to work with the consciousness that's in her and in these sacred sites. Beyond the Obvious was the other book that you're showing, which is my intuition book. And this is really the 7 stages of how to actually bring your intuition into your awakened state. And I try to give as many examples of times where you could just have synchronicities, which are fabulous. Nothing wrong with synchronicities, but to move beyond the synchronicities sometimes. Some people spend a long time telling me about, oh, then this happened, and then this happened, and then this happened. And then I'd say, and what did you do because of that? Oh, nothing. I just wanted to tell you that it happened. So I often think, well, wow, the spirit world, the universe went to all that bother of giving you those wonderful signs and symbols, and you didn't really get it. So I try to go through in this book, or I do go through in this book, there's different levels of how to expand your intuition, take on your own power, and to harness that will. And you'll see that letting go of the result is the last one that's the most difficult. Then I have a Mind, Body, Spirit workbook, which is really, I wrote that just as out of another course that I was doing, the Mind, Body, Spirit, and that I just enjoyed putting lots of different ways, sound healing, intuitive healing, things where it really was a workbook that someone could go through. My next book, I think, was My Healing Power of the Sacred Woman. That was a very deep book of looking at all the aspects of why a woman has the body she's got, what does it mean to be a woman, and what do we need to do to make sure women truly are empowered, not just by sending them to the gym or telling them that they should fight like a man, but why is a woman different from a man? And it's in no disrespect to men in any way. It's more just saying, hey, let's stop saying men and women are the same. There's got to be a reason women have different gifts and different parts of their anatomy, and let's really focus on what it is that a woman has, and let's focus on what a man has. But it really, my focus has been on women. And then my final book that I've just finished is the Handbook of Women's Mysteries, which gives meditations, rituals, practices for women to get back into rhythm with themselves. And that's part of my women's mystery work that you're very kindly showing there. Even has an online course, a 6-month online course, to allow women to return to the rhythm, return to understanding their connection to Mother Earth, to their body. So there you go. I love all my books, and they are very different. So if you ask me, do they have to read them in turn? Absolutely not. You can go through any order you like and jump in where you like. Each of them is complete on itself.
And I want to mention that on this page, there's information about some online courses you offer. So I want people to be sure and go to your website, because you not only have books, but you have online courses and certification, which I think is awesome and cool.
Absolutely. And, you know, if that online course, the Women's Mysteries for the Modern Woman, just to say, it isn't a course that starts on a certain day. I didn't want women to feel trapped into, oh, I've got to do this on this certain day. So it is a 6-month course, but you take it over 6 months and you take it in your own time. So you really can engage in all the meditations, because I love offering meditations, because it's a great way of really being able to listen within, not just listen with your head. Listen to the meditations, listen to your body. That's the key to it. I'm wanting you to have the opportunity to really listen to your inner self and not just what somebody else is saying.
That's awesome. Well, I want to tell the people that are on live, because that's the benefit of being on live, is that if they have a quick question they want to type in. I have 2 more questions for you. But if anyone has a question, please go ahead and send them. And if we have time, we'll cover them. I want to talk a little bit about the workshops, because one thing I've already told you is that, you know, many times when we're doing assessments with New Vision, or we're working with people that, you know, had a similar story to you, that they had gifts when they were a child, but they were suppressed, or they were confused, or they didn't know what to do with it. And then they, you know, we see them and they're completely shut down, or things show up like psychic pain, or not using their intuition to their full ability or capability. I'm going to go back to your main screen here that has the 2 workshops, because they're 2 single days in Houston. Can you just talk a little bit about, I know that this is not just for practitioners, it's for regular people and practitioners. I have this conversation with practitioners as well as lay people, but can you just talk about the 2 days in Houston and who might benefit, like the difference between the 2 days, since they're really separate individual courses?
Absolutely. So the first one you see there is listening to the wisdom of the body. We put that one first. It didn't matter which one, but this is really available to anybody. I mean, I've taught this to people who just have an interest for themselves, or maybe even have an illness themselves, or someone they know who's ill. But for practitioners, I hope that this really benefits, because it is following up on that work that I've been talking about. We will look at the chakras, the meaning, and I know many people have an understanding of that, but I teach it in a way that really says, let's talk to them. Let's do a meditation on this. Let's talk to what the body has to say. And so it's really even the understanding that I've been saying about that. Let's not see the body as just a vehicle or a vessel for something. Let's know that your heart or your liver or your big toe all want to talk to you. And that just turning everything around, coming from the pain point, I know I've said it and it's a theory, but I would like it to be an understanding that your body really loves you. Because so many times I hear people saying, my body failed me. And we have all this language about, I'm battling cancer, I'm struggling with this, I suffer from this, I'm a victim of. And I just cringe, because, you know, if you're constantly told that you're the problem, then you don't always really want to have that conversation. So one of the things that we will be doing in that week, that day, listening to the wisdom of the body, will also be befriending our body and not seeing it as the enemy. So that first day, I would ask anybody, you know, who's going to come along, enjoy it doesn't have to be that you're ill. It doesn't even have to be that you're a practitioner, but just come and listen to your body. Come and see how the energy centers work and affect your body, the chakras. And I know that you'll go away with a deeper insight and hopefully a more loving approach to your body, whether it's how you eat or how you exercise or when you rest, just having pleasure being in your body. Because as you've said, Gwen, that can be tough for many people. They just don't want to be here and they don't want to be in their body. So making a friend with the body, you know, I know that nutrition is a big part of what you're doing. But some people are starving themselves because they really don't want to be here on the planet. And I'm saying is, come on, be nice to your body, be nice to Mother Earth, and maybe you'll have a little bit more pleasure. So what we'll also be looking is at the mind-body connection. So that what are the beliefs you're carrying which are influencing your body, and where is that then appearing in your body? And are the beliefs not just about your body, but are they how you relate to yourself, how you relate to other people? So there's a lot of different information, mind-body exercises, and as I say, chakras, etc. That will be on our first day. Second day is going to be different because it's really about focusing on how we listen to our intuition. What does it mean to be intuitive? What does it mean to be psychic, empathic? Where do we need to have better boundaries? And you'll again have lots of opportunities to practice on each other. What stops us following through on the information we get? What would be my tips that I'll use? Like, you know, the three time rule. If you hear it 3 times, do it. So I'll be giving tips. We're doing exercises. We'll be looking at, you know, different ways in which you might even, you know, get you outside the building and saying, okay, what is the messages around you? So there's so many ways in which we can hear messages. But as I say, the most important thing is not just hearing the messages, doing something with them. And that's I'll be also focusing on.
Okay, that sounds like a great weekend. I'm so glad I'm going. And you're going to be doing private appointments, and I know that you don't have to do them in person because you can do them equally as well on the phone. But can you just talk a little bit about your appointment? Because Houston has about 8 million people, and I think your appointment will be full. Yes. A private appointment will be like with you.
Yes, perfect. And just to say that, you know, we are saying if you want to come to both days, we're even giving a little discount on actually registering for both days on the workshop, because I'd love to have you there for both days, because they are different, and they are, you know, it will be a very enriching experience to have the whole weekend. But again, I appreciate that other people, you know, there are priorities, other things we're doing in our life. So the soul readings, we're just offering a few, because I do know wherever I go in the world, people do like to have a personal one-to-one face presence with me. It's fun for me as well. So we do a 50-minute soul reading. In that time, I will read your energy. I will read your energy from the chakra point of view. Might be past life. It might be anything that I feel is appropriate. And always when I'm using my intuition, it is about how do I make you more connected to yourself? Because that's what intuition is. It isn't about me saying, wow, what a mess you're in. It's about how do I see that something that you're doing may not be working for you, or maybe I'm saying is there's a part of you that is waiting to be embodied that you're not doing. So I look at the challenges inside you and your strengths. And my aim is to make you more whole by what I say and what I do. Sometimes I might do a mini visual imagery with you to just help you to maybe ground your energy or feel stronger. Sometimes I will use my own hands to do an energy balancer, but I prefer not to just be doing a healing. I prefer that I try and, again, translate information to you about who you are. If you are coming to see me, it's lovely if you bring me your astrology, which will be your date, time, and place of birth. I will have my computer with me, and very quickly, because I'm an astrologer, I just love bringing some of that information in as well, because it helps sometimes to say, look, this is what's happening here. But it's not essential. And if you're coming, do bring something you can record the session with, like nowadays, iPhone or anything, because it's really nice to actually not have to write notes, but to actually have it there on a recorder. So I read energy, I look at chakras, I look at your astrology, I will, and then finally, if I will, not final, but right at the very beginning, I always say, is there something you want me to focus on? So if you said, yes, it's my work, my health, my relationships, I certainly will focus on that. And I don't mind if you come in with no problems, or if you come in with something. Of course, I love it when someone comes and tells me, you know, I have this illness and I would like to understand why I have it, or I would like your help on this. This is where I really feel that I enjoy all the work I do, but really helping someone to be more conscious and more expanded in their awareness of what's going on is really my gift.
All right, well, I'm excited about the appointments and the workshop. I want to let everybody know that you can sign up for both the workshops and the appointments on www.christinepage.com, but you can also, because some people were having a little bit of a time finding what to do where, you can also send an email to info@christinepage.com if you want to register and you're having a hard time, or you want to see what appointments are available. So if you're having a hard time navigating the website, she is open to getting an email at info@christinepage.com. I think the appointment slots are going to go very quickly. So if you're listening to this on the call, I would recommend that you book an appointment as soon as you can. Whether you're going to the workshop or not, hopefully you are going to the workshop. What I think is going to probably happen is people at the workshop, if they didn't schedule an appointment, they're going to, which is what always happens. And then those slots will be full probably before then. So they'll kind of lose out, but they'll do it by phone, which is just as good. I want to just say there's only one question so far and a comment. Gaia says, fascinating. I want to learn more and we'll follow up. Christine, Mary has a specific question for you. And she says, what do you feel your message was, I guess, personally from your cancer? So what was the message to you?
A very important one. Thank you, Mary. You know, what I had always taught was that breast cancer was about lack of self-love, okay? But when I developed breast cancer, I realized that that wasn't necessarily the whole answer. What I had done, and I see this in many cancer patients, and in particular in breast cancer, is I had lost the self that needed loving. Therefore, it wasn't about me going off and doing more massages and so. I didn't know who I was, because as someone who is so intuitive, and I think others of you will relate to this, I learned so quickly that if I can read your needs and meet your needs, then you will be happy and we'll all be happy. That's what the definition of being a pleaser. So what had happened is I was so good at reading the needs of other people or what other people wanted, I'd forgotten my own needs. And that's what I learned, was I had to come home to myself. And instead of just saying yes or fine, we'll go along with that, I had to really look inside and say, is that what I want? And was I just going along with others? And that's what changed, Mary. And thank you very much for asking that.
Yeah, I agree. Thanks for asking. I want to ask you on an add-on to that. So do you think there's some aspect of I know this is a strong word, but martyr in breast cancer?
No, you know, you could call it that. I mean, I'll call myself a martyr if you want. But I want to say, you know, I may be just, I'm saying is fine, I'm a martyr, but it's more than that. It's a sense of losing yourself in caring for others. That's much stronger for me. I mean, I just listening to that word, Gwen, it's more is I didn't know who I was. And that might sound strange because you can hear me. I know exactly who I am when I'm teaching. I had no problem saying no when it comes to my work. It was nor in my my marriage. I'm fine. But I realized it was with certain people, we call them friends, but in certain acquaintances, I would go along with people in order to not upset them. And I'm talking to anybody who's been, and I was not, but this is particularly pertinent in people in dysfunctional families. The solar plexus, which is the place of the pleaser, is developed so quickly in a dysfunctional family because your need to survive and be safe is more important that you learn what mum or dad's mood is like than it is about listening to your own needs. And I find a lot of people in the healing professions have highly developed solar plexus, which we then say, isn't it wonderful, they're so empathic. But that has been developed because of a problem that they had in childhood, and they're still terrified that they will not please people. I did not have that. I was not, my family was, I was not in a dysfunctional family. I was just intuitive from the moment I came. I didn't know any different than listening to everybody else. So I have had to train myself to have better boundaries.
Well, thanks for distinguishing that, because I think that's an important thing to learn. And I have one last question for one person on the call, and I'm not going to take any more questions because of time. Beverly's asking, because of, I think, what you also said about women, if you were to look at a woman who had flu-type symptoms, watery eyes, runny nose, coughing, mucus during her cycle, during her menstruation, have you seen any pattern with that type of
I love that question. All I would say is that this is, you know, whenever I see runny nose and flu, there's grief, okay? Whenever anything is running, it's a symptom of grief. It's a symptom of sadness. The fact that your period is actually a time for letting go, connecting, and then rebirth would make me, I'd love to work with you, Beverly, because it's very much, it's like, oh my God, this is what I teach, is that women need to understand that every period they have is a time of dying, reconnecting to their deeper self, and then being born again. And obviously it ties into anything that went on when we were born or in our ancestors. Ancestral healing for women is so important because that birth-death experience that we have with our mother, she had with her family, is so powerful. So I'd want to know what happened when you were born and what was going on when your mother gave birth to you. So,
okay, that's incredible.
Gwen, can I just to reiterate, if you could just move that chart up just a little bit of my web page. What I want to say is, if you want to join us in the workshop, go the other direction. If you want to join us in the workshop, you do not have to contact me on info. Please just wait. There we are. So when you go up, you see sign up. So you can sign up, register for an event. You can sign right into having an event with me. The issue came when I was trying to make appointments. So you'll see, as Gwen just moves this down to register an event, you see book now. If she's just going to click on book now. If you click on that for me, Gwen, thank you. And then if you see it, you'll see here you can click, and you could click on that Saturday, you know, any of them, click on any of it. There's the 2-day or the 1-day, and you're taken right through to being able to sign up and pay. So that's not an issue. The issue was where we were trying to make the appointments for the individual sessions. We weren't being able to make that. So if you want an individual session with me, please contact me in info@christinepage.com. If not, if you just want to come to the seminar and want to come to the seminar, please go on my website. You can see, you can book up now, and it's all available for you whenever you're ready.
And there is a special early bird until March 15th, so there's 2 weeks.
Yeah.
The early bird rate, and we would appreciate if you're going to come to sign up early because of the venue and space and knowing how large the event will be. So I would personally appreciate, and I know Christine would, if you guys would register sooner than later, because it helps us do proper planning. Beautiful.
Yes. Thank you.
Gwen, this is Deb. I just wanted to say hello because I'm an astrologer too.
Oh, fabulous.
So I was just happy to see that you're using astrology and sacred geometry in your work, and I think that's really fabulous. And I've been to the sacred sites, and it really is an amazing experience, and things really change afterwards. After you've been, your consciousness really does change when you've been to Stonehenge and touched the stones and Glastonbury, and sometimes it takes a period of recovery afterwards. Definitely.
So
but
true.
Thank you so much.
All right. Well, Christine, I appreciate your time. It's very valuable, and I look forward to meeting you in person in Houston myself. And so we'll talk and see you then. And I want you guys to register and sign up for private appointments or workshops as soon as you can. If anything she said tonight interests you, then you're going to want to be at this event on the weekend of the 21st and 22nd of April. Thanks again, Christine, and I'm sending you lots of love.
Lots of love, and bless you, and bless everybody out there. And thank you, Linda, and everybody else who's been helping out. But just look forward to meeting lots of you, possibly in Houston and maybe somewhere else around the world. So love to you all.
Thank you. All right. Good night, everybody. We'll talk next week.